As this virus continues to emerge and spread around the world, we're learning more about the pace of transmission, how quickly it spreads. We're also learning more about the severity of the virus, how likely it is that if somebody gets sick, they're going to end up in the hospital or even worse. And what we are coming to understand is that this is a virus that spreads very quickly. And it's also a virus that sometimes spreads silently, meaning that people may be contagious, may be infected with the virus, but not yet have symptoms. And so they don't even know that they're sick and possibly spreading the disease to others. And we also are learning, and we've known for quite a while, that this virus can be quite severe for older people and for people with underlying conditions. So there are things that we still don't know about the fatality rate for this disease. While it is clear that it is a very severe virus and it is making some people very sick, and there have been a climbing number of deaths attributed to the virus, we really don't know with certainty what the case fatality rate is. What that means is what is the likelihood that if you become infected that it will ultimately kill you. And the reason we don't know that with certainty is because while we have a lot of information about how many people who have died for the disease, we don't know how many people who have been infected. It is much easier for us to detect people who die from the disease than it is for us to detect how many people who have been infected with the disease, including possibly very mild or asymptomatic cases. Yeah. So as we just discussed, this is a very serious virus. It has a high case fatality rate in some age groups and risk groups. And so we want to protect those people and prevent those people from becoming infected. And the reason we can't just isolate those people is that this virus, it spreads very quickly and sometimes silently, meaning that people can spread the disease even when they don't know they're sick. They can spread asymptomatically. And so in order to stop transmission, we really have to limit the extent to which people come into contact with each other. And one of the big concerns is, not only that high risk people will get infected and have severe outcomes, but is that if we don't implement these kinds of extensive control measures, the cases will climb so quickly because of the speed with which this virus spreads that our hospitals won't have enough beds and won't have enough staff to treat the cases that really need health care. So at this point, we really don't have the data to say with certainty whether summer weather, warmer weather, higher humidity will have an impact on the spread of the virus. We do know that in general, the spread of respiratory viruses is highly seasonal, and that epidemics are more likely to happen during the school year as opposed to the summer. For influenza viruses, there is some evidence that weather is part of this equation. Weather is part of what slows transmission in the summer. However, the most important factor is our own behavior. One of the key drivers, the reasons that we don't see as much virus in the summer as the winter, is because kids aren't in school. And when they are in school, they spread disease to one another and they really amplify transmission of viruses throughout the whole community. I think as we learn more about how contagious this virus is, as we see more and more cases happening in healthcare centers, as we learn that this virus can actually sit on surfaces for hours or even, longer than a day, not only healthcare workers, but I think the population in general is taking more precautions to limit possible exposure, not only through direct person-to-person contact, but also from contact with common objects. I think this is a really vital study. This is really important, and it will lead us to take even more precautions in terms of protecting healthcare workers, protecting people who might be at risk for severe outcomes if they become infected. It just means we have to be all the more cautious when we are coming in contact with people that might be infected. I think that the United States is taking this threat very seriously. And a lot of the decision making is happening at a local scale, cities taking actions as they see cases climb in their own populations. And this is not overblown given the severity of the virus, given that there really is high risk for hospitalization and worse in some age groups and risk groups. And these are the steps that we need to take in order to protect our population at this point. It's very hard to predict what is going to happen going forward. The things we do know are that if we take measures now, we can limit transmission. We have seen outbreaks be controlled in other countries in the world when they take measures to rapidly identify and isolate cases, quarantine contacts of their cases, and enact other broader social distancing interventions. So I think there is some hope from the examples of other countries and other populations that if we are proactive, if we are aggressive, we can limit the spread in the short term.